Hey everyone, welcome to the CEU on the incredible importance of self-care and burnout prevention. We are going to talk about the importance of self-care and preventing burnout both in ourselves and our supervisees, and why it's so important that we as a field prioritize self-care and really look at factors of burnout and what we can do to prevent that and what we should do if it does occur. A little bit about me. I am Ashley. I have been working in the behavior analysis field since 2009. I was fresh out of high school, looking for a college job as I pursued my psychology degree and landed what was called a line therapist position, which is essentially now the behavior technician position. And then I just kind of worked up the ladder, and then in 2018, I became a BCBA. So I have been a BCBA for about 4.5 years now. My primary area of expertise has been with young children, but I have worked with, 1.5 to 21. I do have a preference for toddlers. I very much enjoy them. They're hilarious and tons of fun. I actually have one of my own. I have 3 kids, but 1 toddler. My boys are 3, 9, and 11. I do have a neurodivergent son who has kept me on my toes and has really been the inspiration for a lot of what I do. So why are we talking about self-care? Why is it so important in this field to emphasize self-care and create a culture of valuing self-care? For much of my career, I really didn't hear much about self-care or burnout. They seem to be things that, burnout was something that happened. Looking back, I can see signs of burnout in my supervisees, myself, that maybe I just didn't have the words to express what it was, what people were experiencing, and just thought like, oh, this field maybe isn't for them and they're leaving, which is fine. That does happen, and not without it being burnout. But I just really didn't see anybody really prioritizing burnout. It really wasn't until 2021. So last year I read an article titled "An Invitation to Act on the Value of Self-Care." It was really eye-opening. I was so excited to see that self-care and discussions of burnout in our field were, present in the behavior analytic research. And there was, it seemed around that time, that was the midst of the pandemic. It seemed that people were starting to identify why self-care was so important and needed, and why we really needed to do more research in this area and develop strategies to reduce this and, make well-needed changes. So unfortunately, in early 2022, I really experienced some major burnout. So like I mentioned, I, maybe saw some signs of burnout in the past in myself, but never, acted on it or changed anything necessarily. But earlier this year in 2022, I experienced a major burnout episode or experience. It was a combination of home and work life. Things overwhelming me both at home and at work, and maybe not being able to be present as much at home as I needed to and wanted to. So that really did, lead to me branching off into private practice. Of course, it all turned out great. I'm totally enjoying what I'm doing. But that experience really had me reflecting on what we as a collective field can do to prevent burnout in ourselves and our supervisees. The field really has so much potential. We can do incredible things with this science. We have to take care of our clinicians. The cost of burnout is so incredibly high, both at a personal and an organizational level. So it really does pay to make this a focus. So we have to be talking about self-care and ways that we can be preventing burnout, and how, if our antecedent strategies are not effective, what can we do as a consequence strategy to, reduce that burnout and keep people in this field, keep them, increase their job satisfaction and all of that. So our learning objectives. These are the things that we'll be discussing today. So let's operationally define burnout. Let's operationally define self-care. Let's identify self-care antecedent manipulations for burnout, identify signs of burnout in others and ourselves, identify antecedent strategies for preventing burnout, and identify consequence strategies to take when burnout is observed. So those are the things that we'll be chatting about today. All right, but first things first. Naturally, we're in the field of behavior analysis. We need to identify and define what we are talking about here. So what is burnout? There are so many different definitions that I came across on burnout. The one from the World Health Organization that they provide is burnout is a syndrome conceptualized as resulting from chronic workplace stress that has not yet been successfully managed. So that ongoing stress leads to burnout. They then further characterize burnout by 3 dimensions. So feelings of energy depletion, increased mental distance and from one's job, and reduced professional efficacy. And then they clarify that burnout in this sense refers to a phenomena that is in one's occupation. So it doesn't apply to other areas of life. Of course, I would argue that you can be burnt out, in any area of your life. But for the purposes of this presentation and discussion on burnout as related to our field, we're going to be using this definition and talking about burnout related to one's occupation. But let's break that down a little further. So feelings of energy depletion, increased mental distance, reduced professional efficacy. These are all private events, but we radical behaviorists know that private events are behaviors. So there are ways that we can personally measure these characteristics, making them behavioral in nature, and we can conceptualize burnout then in a behavioral manner. Right, now let's get into how to define self-care. So again, there were multiple definitions I came across when I was researching this. I was mostly drawn to a values-based definition. So the values-based definition was provided by that article that I mentioned earlier by Fieberg et al. 2020. That article is titled An Invitation to Act on Self-Care. It's an excellent article. I really recommend it. It completely opened my eyes and changed my perspective on self-care. But their definition was my most preferred. So we are going to go over this definition of self-care. So self-care is a repertoire of practices that includes values-directed actions across many domains of life. So it's not just one action or, 1 or 2 actions. It's a repertoire of practices. So there are many different ways that you can engage in behavior that aligns with your values. So that's essentially what it is. So in order to act on this definition of self-care, you first have to clarify and commit to an overarching value of self-care. So do you value self-care? I think that most people attending this course are probably value self-care or want to get to that point, want to learn more about how to value self-care. So I assume all of you can, check off number 1 there. So once you do clarify and commit to that value of self-care, then you're going to commit to act congruently with personal and professional values across many domains of living. So acting within your values, that is demonstrating that self-care. And then practicing self-compassion. That might be the most difficult for some of us. I will say that is the most difficult for myself. Self-compassion has been, I've always been my, own worst critic. It wasn't until I noticed my oldest son, Cameron, saying and doing things that showed a lack of self-compassion, that, just beating himself up and being hard on himself, things like that, that I realized, like, oh my gosh, that's what I do. And it was hard to, watch it unfold in somebody else and realize I'm doing that to myself. I have to stop. So, identifying, practicing that self-compassion is just a vital piece to self-care. It's definitely still a journey for me, but, baby steps. And I am sure many of you are on that same journey with me. So solidarity. Good time to pause and give you the first keyword. So the first keyword is progress. Progress. You're going to need to enter that keyword to demonstrate that you are attending to this CEU in order to get that certificate. All right, so progress is the first keyword. Make sure you make note of that. Self-compassion. So another note on self-compassion. I know you've probably all heard this saying before. You cannot pour from an empty cup. That's something that I really do try to live by. As a mom, a BCBA, a wife, dog mom, all of the different responsibilities that, we have. I cannot do those adequately if I'm not demonstrating self-compassion and self-care. So I really do feel that I need to value caring for myself first before I'm able to, really provide support to my children, to my family, to my clients. So I would say in a perfect world, anyone working in this field would value helping others. So if we do value helping others, then we really must value caring for ourselves first. And that's not to say that if you struggle with self-compassion that you don't care for your clients, or that you don't value helping others. Definitely not making that implication. I just feel pretty strongly that in order to truly make the most difference in the lives of our clients, we have to take care of ourselves first. And part of taking care of ourselves is demonstrating that self-compassion. If we're going to have compassion for our clients, let's start with ourselves. All right, so now that we've got the definitions out of the way, why does it matter? Touched on this a little bit earlier, but let's kind of expand on it. So why does burnout prevention matter? Why are we talking about this? Burnout can lead to so many negative effects on individuals and organizations as a whole. And really, honestly, the field in general. If people are getting burnt out, they're going to be leaving the field. They're going to tell other people, and there's going to be less folks who want to pursue this kind of career. So burnout can definitely lead to a lot of negative effects on the field as a whole. So first, let's talk about turnover. Burnout can lead to turnover. We're well aware that turnover is an issue in this field. It's hard to find and keep high quality staff, especially behavior technicians who are often, unfortunately, underpaid, and they oftentimes work in challenging situations, high stress situations, when they're working with challenging behaviors. So when our staff are getting burnt out, it definitely does not help the turnover rate. Preventing burnout can really reduce turnover, saving organizations money, time, energy, all of that. So turnover is a big reason why paying attention to burnout and addressing burnout matters. Next is health challenges. Let's talk about what type of physiological challenges burnout can have. So research does show that there are many physiological effects to those experiencing burnout. So whether that's migraines or stomach issues, whatever it is, it becomes such a cycle. Because, if somebody is becoming burnt out, then they start experiencing stomach issues that they're then calling out for and not, attending sessions. Then your client is not getting the needed care that they're recommended. There's so many different components and so many negative potential outcomes. And it's just a cycle, negative cycle. So if our staff are becoming so burnt out that they're experiencing health issues, that's not okay. We can do better. Poor job satisfaction. We spend so much of our lives working. Such a huge chunk of our lives is spent working. I can't think of a single reason why we should be doing that without enjoying it. Life is just too short simple as that. Life is too short to not enjoy what we do. I don't want, if I were a parent who had a child receiving ABA therapy or any treatment for that matter, I don't want somebody coming in and not enjoying what they're doing. If you're working with my child, I want to see you happy and running around, appearing as though you are enjoying yourself. I don't want somebody who frankly just does not like the job, doesn't like the career, the path, whatever it is. So I want my supervisees to enjoy what they're doing as well. Like I said, life is just too short. We spend way too much time working and not enjoy it. So poor job satisfaction is a big reason why we need to pay attention to burnout and prevent it. As with negative health outcomes, there's also negative mental health outcomes. So those kind of go hand in hand. And oftentimes coincide that, somebody is feeling burnt out, then they're having health issues, and then they're losing out on money because they can't make it to work, and that's putting stress on the family, and then they begin to have depressive symptoms, and then they hate their job. So as you can see, it can just cycle out to all of these. So again, negative mental health outcomes is another factor and a reason why we need to be preventing burnout. And then I touched on this, stress on family members. That often comes from different components of different factors of burnout and negative outcomes of burnout. So if you're making less money because you're burnt out and you don't want to go to work, or you're having negative mental health or physical health outcomes, that can impact the stress being placed on your family. And then poor quality of care. Not that the other ones are not important by any means, but poor quality of care, I want to say, is probably the most important. Burnout can lead to our technicians, ourselves, not providing adequate high quality care. If we are providing subpar care, then our learners are not developing at the progress rate that they should. They are the ones that suffer as well, suffer significantly if we are all getting burnt out and hating what we do. Maybe staff will start forgetting to record data, or maybe they stop following the BIP because negative reinforcement is so powerful and they just want that behavior to stop in the moment. Thus, again, reinforcing that cycle. So poor quality of care is a very big reason why we need to be paying attention to self-care, reducing burnout, and having strategies in place to prevent it and act on it when it does occur. So those are all really important reasons why. But now let's go ahead and analyze predictors of burnout. So what can we do for better outcomes in this field? So to further analyze this, let's look at some of the predictors of burnout and what we can do to manipulate the environmental variables, so those antecedent strategies, to reduce the likelihood of burnout occurring. I don't think that we'll ever completely eliminate burnout. I think this field can be challenging. It's not for everyone by any means, but there are so many things we can do to greatly reduce burnout from occurring. Let's start by looking at some of the factors of burnout. So a combination often of high work demands and low support is one of the factors, predictors of burnout. That can go, one can go without the other. So somebody having high work demands but high support can still become burnt out, but it is oftentimes a combination of those two. So there are some things, of course, that we can do to pretty easily address this and reduce high work demands and increase low support. All right, so the first antecedent strategy for this predictor of burnout is assigning cases aligned with one's expertise or areas of interest, their niche. Oftentimes, in my experience and in this experience of many that I've talked to in this field, BCBAs and RBTs, actually, even more so, are kind of just thrown cases because it's available. So a client moves through intake and gets assigned a BCBA, whoever has available capacity on their caseload. This can become problematic because oftentimes BCBAs are then, and RBTs are then, working with clients that maybe are above their, or outside of their areas of competency. So for example, maybe the majority of your clients are, older 12, 13, 14-year-old kiddos who are more social skills directed. And then you get thrown a 4-year-old who needs verbal skills work and behavior reduction. And those are very different areas of competency that you would expect if you're being assigned to something different like that, that you have that proper support and supervision through that. But then also I do think that, there's value in getting different experience. So experiencing different clients, different age groups, different populations. But then allowing, as people get that different experience and they identify what their niche is, really allowing that individual to pursue that and have more of a heavy focus on their caseload in that area. I mentioned at the beginning in my little intro that I love working with toddlers. I think if I had a full case of toddlers, that would be perfect for me. That's my, ideal caseload is 2, 3, 4-year-olds, a few 5 and 6-year-olds in there too. Those guys are fun too. And that's just my area of interest within the field, that I when I'm working with a toddler, I feel personally happier than when I'm working with maybe a 13-year-old. And there's nothing wrong with that. I think everybody's got their areas. Some people love working with teenagers. Whew, I'm going to have one in a couple of years, so my own son. I'm not ready for those years. Maybe that's why I keep going back to the toddlers. But anyways, all right, so assigning cases aligned with expertise. I think that is a really beneficial strategy, antecedent strategy to improve job satisfaction and reduce burnout. Increase supervision. So how many times can you think in your career have you been similar to what we're talking about? Have you been thrown a case that is very challenging for you and you are not being given any increased support through that? I'm sure many of us can recall at least one time that's happened in our careers, and it can be really overwhelming and definitely lead to burnout. So increasing supervision in whatever way we can for our supervisees, and for us requesting additional support from our employers. That's a big one too, to make sure that we're getting the proper supervision and feeling well supported. Preference assessments. Preference assessments for our supervisees is an awesome idea. I had a previous employer who, for all new employees, she would send a preference assessment that had different things about like how you prefer to receive feedback. Are you one of the people who like to have an announcement at an all-staff meeting like, hey, so-and-so did an awesome job? Or do you prefer, one-to-one direct feedback and you don't like to be called out or given that like group feedback? Those are really important things to know to make sure that our staff are feeling supported and getting feedback in a way that feels comfortable for them and isn't in any way, overwhelming. Because that's not the point of feedback. That's not what we want, of course. And then seek feedback. So from our supervisees, seeking feedback, preferably like anonymous feedback via a survey you can send out like monthly or quarterly, however works for your schedule. Just getting that idea of what they find valuable in the way that you provide supervision and what you might need to work on. So that's another one. Do not micromanage. So this is the one that I'm going to put as a negative as opposed to all of the what you should do. This is the one you should not do. I find some people seem to kind of coincide micromanaging with increasing supervision. So like, oh, okay, people are getting burnt out because they have low support. let me micromanage them. That'll help. No, let's not micromanage. Let's see what they individually need, what type of support they need, rather than, having a base level of supervision and support. Assess their needs. What areas are they competent in? What areas could they use additional support in? How often should you be supervising them, and what changes do you need to make to, be able to supervise them at the rate that they need, at the frequency that they need. So definitely don't micromanage. Don't be that person. Just don't. Create a culture where self-care is valued and prioritized. There are many ways that you can create this culture, where you, in your company or in your supervisee group, where it's clear that you value self-care and you are concerned about the well-being of your employees, of your staff. So that might be like sending out mental health tips, or, monthly newsletters with little tidbits about self-care. That might be allowing mental health days, which I know is a little bit of a radical idea, but I think that could be highly valuable, allowing people to know that it's okay to need a break, to take a break, and not making it the end of the world when somebody needs a day off. So those are just some ways, but there's lots of ways that you can, create a culture where self-care is valued and prioritized. Moving on to this predictor of burnout, which is feeling ineffective. So what can we do to avoid our supervisees or ourselves from feeling ineffective? Because feeling ineffective has that cycle effect where it then, leads to that burnout. So I think one thing is improving our training procedures, not necessarily on behavior analytic procedures. So not necessarily improving our, training of RBTs on, verbal behavior or differential reinforcement or anything like that. I think that, we've got under control, but let's train staff on soft skills. So the development of skills like perspective taking and active listening have actually been shown in research to act as a buffer against burnout. So let's take a responsibility for helping our staff and ourselves improve those type of soft skills. That can definitely reduce feeling ineffective and then, leading to that burnout. All right, and then let's find your niche and encourage your supervisees to do the same. So I know the majority of BCBAs today are working in the field with children with autism. Oftentimes working with insurance-based or Medicaid-based funding. But there's so much more that we can be doing with the science beyond that. I know a lot of people mention that there aren't as many jobs out there that are outside of the autism field. So there's definitely a lot of barriers and a lot of more research and an emphasis that needs to be placed on this. But I think helping your supervisees to identify different areas that they can go in this field. So maybe it's behavior, working with sports medicine, or maybe it's OBM. That's a growing subset of ABA. Encourage your supervisees to not have that necessarily narrow focus on working with children with autism if that's not what they're passionate about. Maybe they love the science, but want to explore what else they can do in this field with a behavior analyst certification. Or maybe they don't even know to want that necessarily. Maybe they don't even know that there is other things. So helping, I think this is just a big thing that we can do in general, is helping our supervisees understand that there are other areas that they could go with this field if that's what they were interested in. And then establishing rapport with our supervisees. I know some people are kind of, they go into work and kind of very direct and focused on the kiddo. Let's make sure that we are addressing some rapport. So making that rapport with our supervisees, making them feel comfortable that they can come to us, that we are on the same team, all working for, a goal of it improving the lives of our children, our learners. And then balancing positive and constructive feedback is another way that we can reduce this feeling of ineffectiveness with our supervisees. I'm sure many of you have heard of the sandwich method for providing feedback, where you give one positive, one constructive, and then another positive. But research has not supported that. Actually, research has found that it can be really confusing. And when you think about it, it makes sense. Like, hey, you're really, really awesome. But wait, hey, can you do this? But you're really great. It's like, it can be really confusing. Like, wait, am I really great? Or am I doing? So instead, be direct with your feedback. It should be either positive or constructive. So not both at the same time. So kind of direct what that feedback is going to be and stick with it. Research has supported more of like a 5-to-1 ratio, about 5 positive to every 1 constructive, but there's nothing to support that it should be exactly that. Like you're probably not doing yourself or anyone any favor by sitting there and being like, all right, I just gave her some positive feedback. Let me tally that. Ooh, okay. Yeah. I better give another constructive feedback. You don't want to get too, obsessed with a specific ratio like that, because then are you really providing valuable feedback? Maybe not. Maybe you're kind of forcing it because you feel like you have to. So rather just try to balance that positive and constructive feedback, but make sure it's valuable feedback and it's, being provided in a direct manner so that they understand exactly what the expectation is, which leads me to the next point: clear expectations. It's so frustrating and challenging when you're kind of thrown a task and you are not provided instruction or direction on how to complete it. You're just expected, like, hey, you're a BCBA, you probably know what you're doing. Here, take this. Or you're an RBT. I'm sure somebody's trained you on this. Here, have this task. So make sure that your supervisees understand what you are asking of them. I'm a huge proponent of BST, behavior skills training. So I recommend training your staff using that method. And then in addition to clear expectations, regular feedback. So how often are you providing feedback for your supervisees? And this should be both informal and formal. So you might be providing feedback, I would hope, at every session. But then are you providing like overarching feedback on what progress, your supervisee has made? I worked for a company who did like a weekly performance log, which was really great. It had just general measures of like how they are doing their job. And it was very easy and quick to fill out, check. Yep, you're doing awesome. And then just took a minute or two to go over that kind of feedback. But it was nice to just have that weekly touch base. Like every, Monday, my BCBA is going to be here and go through feedback with me. And I know it's just that expectation. Like, I know I can expect this. And there's never that wondering of like, am I doing my job okay? I'm sure some of you have probably felt that before. Like, I haven't heard much lately. Am I doing all right? Sometimes I think we overlook the people who are doing really great because we're so focused on who needs improvement that we kind of just overlook them and, think to ourselves, maybe, subconsciously think like, oh, they're doing so great. I think they've got it. Just let them keep chugging along. But even people who are doing awesome need that ongoing feedback to, have that reassurance that they're doing good, that they're on the right track. Everybody, should have that and deserves that. Right. Let's set boundaries. Are you a yes man? Do you often, when your supervisor gives you a task, are you often the one to just say, yep, I'm on it, got it, no problem, no worries? When was the last time you said no? Consider saying no more often. What are the consequences if you were to say no? So say you've got a large caseload, you've got however many clients, and your supervisor hands you another one and was like, here you go, you've got another intake. What if you just said, I'm sorry, no, I can't take on another client right now. I appreciate your support. Thanks for your understanding. I understand that there's going to be certain consequences with certain companies and providers that may be different from others. I would hope that many companies would be respectful of one self-advocating and identifying that taking on another client would be above their capacity, whatever that individual capacity is. It's not going to be the same for everyone. Somebody more experienced might be able to, or not even, I shouldn't even just say experienced, but somebody else might be able to handle more clients than others. And again, there's just so many different factors because it's, the number of hours that each case needs, the level of intensity, the types of programming, all that kind of stuff will go into how many cases somebody can take. So just identifying, like, if I take on another case, I can't provide effective care to all of these cases that I'm already on, and I won't provide effective care to this new case. I need to say no. So I very much encourage you, as an incredibly powerful act of self-care, to just say no. I say that as if it's so simple. Guys, I totally understand. It's not always going to be that simple. You have, like I mentioned, you have to consider what the consequences are. And, think about the consequences in both ways. Like I mentioned, if you take on that case and just accept it, then there's going to be negative consequences. So kind of balance the risks and benefits. See, ideally, you'll likely see that the risks outweigh the benefits. Also, saying no opens you up to have the ability to say yes to the things that align within your values. And this is just kind of an overarching reminder that, saying no really just can be very valuable and help you to demonstrate self-care by aligning the things that you do with things that are within your values. So as, behavior analysts and other professionals in this field, we should, of course, follow the data. So what does the data show that we should be doing? What changes should be made? We need to be analyzing and measuring burnout levels and things like that to identify when our staff are burnt out and what we can do about it on an individual and company-wide level. So, I would argue it is the responsibility of an ABA provider, a company owner or clinic director, to assess for burnout in its employees. With the tremendous potential that burnout has to cause harm on individuals, organizations, the field, our clients, we should be monitoring our employees and supervisees' burnout levels and taking action, making changes when burnout is identified. I think I mentioned, burnout it's not something that's necessarily going to completely go away. I think that we probably will, on an ongoing basis, still have situations that are just overwhelming. And despite support, things are not going to go well. And, you might start experiencing some burnout. But let's look at how we are measuring these levels of burnout and make sure that the changes that we're making reduce that burnout. So let's use a functional assessment approach. So first of all, there are tools out there such as the Maslach burnout inventory that you can use to assess for your employees and supervisees' burnout levels. I think starting there is a great idea. So getting a good baseline measure and then reassessing on a regular basis to identify, is their burnout increasing? Is it decreasing? We're making changes to address this, to target this. Are the changes making any difference, or do we need to reevaluate? We should be using a functional assessment approach to burnout factors. In other words, let's look at what those setting events and antecedents to burnout are. What are the consequences that are occurring? Taking that functional assessment approach is really helpful in identifying individual strategies that you can take within your organization. It can really provide that guidance on what specific modifications you might make. Here's another keyword. So empathy is our next keyword. Please make note of that. You will need to enter that shortly. Another thing that you can do is establish, like on a company level, procedures that demonstrate self-care as a priority. So again, that showing that you value self-care as a organization in general can be very valuable, and providing resources for your supervisees and employees in advance before they get to the point of starting to feel burnt out. So I like this idea of creating an individualized company individualized burnout measure. So this is just like a simple, how are you feeling kind of check-in that you can create to help guide your trainees. So encourage them to self-evaluate how they're feeling, maybe on like a weekly basis, and identify what changes they should make based on how they are feeling. So, and this is specific to burnout. So, the big smiley face, dark green, keep cruising along. Things are going great. I'm feeling good. Don't need to make any changes. The light green, it's like things are going fine. No big deal. I'm doing good. Maybe there's one or two things that are going a little rough. In that case, they could evaluate their stressors, seek some peer support. Yellow is, not doing so hot. I'm maybe not completely burnt out, but I'm definitely heading that way. Encourage them at that point maybe to check in with their supervisor, have a meeting, as soon as possible to discuss what might be stressing them out, what changes could be made fairly easily to get them back to green. The orange one, not doing so great, really starting to feel that burnout, not happy. Maybe I'm starting to call into work more often. Maybe I'm making errors, mistakes. You start to see those, the red flags of burnout. In this case, I would encourage, of course, make your own scale, but at this one, I have taking a mental health day, which I know is a little bit of a radical, I mentioned earlier, radical idea. But I think that it can do incredible things by making it clear to your supervisees that mental health is just as important as physical health. So there's nothing wrong with taking a mental health day. We all need it. So allowing them that ability to take that mental health day when they are feeling at that level. Maybe also at this point, scheduling like a meeting with somebody, a superior. So maybe somebody beyond their supervisor. As a, touch base, like, hey, what can we do to better support you? Maybe even like the clinical director and your supervisor or whatever, just to, make sure that everyone's on the same page and that we're all supporting and showing that it's more than just your supervisor that supports you. Everyone in the company wants to see you happy and succeeding and enjoying your job. And then the last one then is the red, not doing great at all. I'm completely burnt out at this point. It's probably leading to, thoughts of quitting, things like that, that we don't want it to get to. So ideally, preventative strategies, those proactive antecedent manipulations, should reduce the likelihood of anybody getting to that point. That would be, of course, in a perfect world. But I do think that having this kind of scale can really help your supervisee to I see that you value self-care, that you value them as an individual, and that you want them to succeed and want them to seek out support when they are feeling burnt out. Here are some burnout red flags. So if you are assessing for yourself or your supervisees, you should on an ongoing basis, be assessing for burnout. So identifying if you're seeing these red flags, it might be a sign that you should pay a little bit more attention. Maybe meet with your supervisee or your supervisor if it's you that's feeling burnt out to identify, is it burnout or is it something else? Either way, I would say it deserves a closer look. And these red flags don't necessarily mean that that somebody is feeling burnt out. Maybe they have increased absences because they're really sick, and it has nothing to do with burnout. They wish they could be there, but can't make it because they're really ill. So either way, like I mentioned, just taking a closer look when you're seeing these. So increased errors or reduced work performance. Are you noticing that you are providing the same feedback every time you see a certain staff, even though they used to be super receptive to feedback, would implement it right away, wouldn't be an issue. Now you start seeing them doing things that you've talked to them about before, and they are continuing to make that same error. That could be a sign that they're experiencing this burnout, and that you need to intervene and discuss it with them. Increased absences. So again, like I mentioned, increased absences might just be they're sick. They have life. They have kid situations. Their kids are sick, whatever it is. But if somebody who previously had pretty good attendance starts increasing their absences, I would say that that's a sign that you should pay a little bit more attention. Requesting a reduced workload. And then requesting a reduced workload, requesting more supervision, and or reporting a concern that they're feeling overwhelmed. Those are all very outward signs that somebody is feeling burnt out. And it might be a sign too that they're really at that point of like rock bottom, like I need something to change, or I'm going to have to quit, or, I just can't do this anymore. They're like final limit. When that happens, when somebody is advocating for themselves, first of all, yay for self-advocacy. We need to be doing that more often. But when somebody is advocating for themselves and those modifications or those requests are not taken seriously or just kind of brushed under the rug, then we're just kind of allowing them to get to that point of burnout. So for example, if you have a very heavy caseload and you attempt to tell your supervisor, no, I can't take on another case. And they're like, oh, don't worry. You're just kind of getting used to things here. This is a very normal size caseload, 12 cases, no problem. You should be able to do that. Everybody else does it. All of those, guilt trips. If that's happening, then we are just allowing that person to feel burnt out and just continue that cycle. We can do better. We should be acknowledging our staff's requests for modifications and identifying that if they are requesting for changes like that, it's possible that they are experiencing some level of burnout. Increased criticism toward policies or procedures. I feel like I've totally been there where, I maybe didn't realize that I was starting to get burnt out, but I can recall feeling very cynical about everything and criticizing like, oh, this new change or that policy, and just complaining about everything, venting a lot. Venting is very healthy. I think everybody should be able to vent. But if you notice yourself increasingly venting and complaining about specifically like policies, procedures, things that are going on at work, that might be a sign that you're starting to feel burnout. Or if you're hearing, about staff complaining about things, then maybe they're feeling some burnout. So definitely worth exploring more. And then the last one is poor job satisfaction. So if you're measuring your staff's satisfaction with jobs, maybe either directly or via like anonymous surveys, and you're identifying that they're starting to score much lower than previously, or in general, the scores are poor, then that might be a sign that they are feeling some burnout, and your organization may need to make some modifications to reduce that burnout and make the company more of have more of a culture of self-care to reduce that burnout. The next keyword here is compassion. Please make note of that for to demonstrate that you are attending to the CEU. And then some final suggestions here for prioritizing your values and self-care. So plan self-care into your daily routine. So whatever that self-care means for you, actually embedding it into your daily activities. Schedule it on your planner, even if it's, whatever it is, having that be, having reminders of that right in your daily routine will help it to become natural and help you to better live your life in a way that's aligned with those values, because that's really ultimately what self-care is. And then my final challenge here. So I want you to identify what your top values are. There's a handout that you'll get here with different values that you can just kind of evaluate, take a look and find some of the top, maybe 5 values across each domain that are most important to you. And then determine, evaluate your behaviors across multiple domains in your life. So your home life, your social, your work life. Are your behaviors, your actions aligned with your values? So this is some self-reflection on whether or not they are. If not, what could you change to better align them? How might this reduce or prevent burnout? How might it demonstrate that you are valuing self-care and engage in self-caring activities? So just some, reflection pieces there, and then plan to assess your current burnout level in some way. Whether you're doing it yourself or using like a tool, Maslow inventory, or maybe your supervisor, employer is sending out an inventory, whatever it is, but being able to regularly then assess that burnout level and identify when you're heading in that direction, so you can really self-advocate for what needs to be changed in order to reduce that burnout and hopefully prevent it from occurring again. So that is all I've got for you guys. Thank you so much, all of you, for attending. I really appreciate it. I hope that you found value in this. I know self-care and burnout prevention is such a passionate topic of mine. I hope I did it justice, and I really look forward to hearing all of your feedback. Please take care of yourselves, and I look forward to seeing you guys on the next one. Thank you.